To lead our discussion today, I'd like to introduce our session moderator, Corinne Alberts. Corinne joined National Organization of Rare Disorders in 2020 as a policy analyst. She works to advance policies to improve access to quality and affordable health care for patients with rare diseases. Prior to NORD, Corinne worked at the Leukemia Lymphoma Society Office of Public Policy, where at the state health policy working on emerging issues. Corinne received her MPP from American University and her BA in Social Relations and Policy from Michigan State University. And now I'd like to turn it over to Corinne. Thank you so much for joining us today again.
Thank you, Alicia. Hello, everyone, and welcome. My name is Corinne Alberts, and I am going to be the moderator for today's discussion on navigating insurance, Social Security, disability, and patient assistance programs. At NORD, we know that many rare disease patients have acute healthcare needs and depend on frequent access to doctors, specialists, and medication in order to maintain their health. We also know that health insurance is a key part of gaining that access. However, shopping for insurance and wading through all of that jargon to figure out what plan works for you and your specific needs can be quite difficult. And the same goes for tackling Social Security and disability. We hear time and time again here from patients about how daunting it feels while applying for disability and that patients feel like they don't even know how to start that process. Finally, living with a rare disease can put a significant financial burden onto families and patients and sometimes even put treatment out of reach because of the cost. That's why since the mid-80s, NORD has provided assistance programs to help patients obtain life-saving or life-sustaining medication that they could not otherwise afford. Now, our goal for this panel is to provide some clarity and to demystify insurance, disability, and patient assistance to help make our attendees and viewers feel more informed and confident when navigating these programs. We have three fantastic speakers lined up for today. Each of them are going to speak for about 10 minutes, and then we will all come together at the end for a group discussion. To make things simple, I'm going to introduce our speakers individually before their dedicated section, so you're going to hear from everybody a bit later. All right, so that was my quick introduction, and now let's just dive right into our presentations with our very first speaker. So I'd like to hand it over to Ellen Laramie. Ellen is the Outreach Coordinator for Access Health Connecticut. Access Health Connecticut is Connecticut's official health insurance marketplace where you can shop, compare, and enroll in quality healthcare plans. If you live in Connecticut, which is where NORD's main office is, Access Health Connecticut is the only place where you can qualify for financial help to help you lower your costs or be eligible for free or low-cost coverage through Husky Health, which is the state's Medicaid program. Ellen, thank you so much for being here today. Please take it away.
Thank you, Corinne. Thanks for having me. I appreciate everybody's time. Today, I'd like to talk about what is Access Health Connecticut, and Corinne just mentioned a little bit about what we are, what is the marketplace, and what is the American Rescue Plan and some of the benefits impacting the marketplace. So what is Access Health Connecticut? We were established by state law in 2011 to meet the requirements of the Federal Affordable Care Act. As Corinne mentioned, you can shop, compare, and enroll in quality health plans from brand name insurance companies. And we are the only place where you can get financial help to lower your cost or be eligible for free or low-cost coverage through Husky Health, which in other states is Medicaid and the Children's Health Insurance Plan. I think a great thing is people often ask me where to start. Start at our website, and you can go to our compare button, and you would be able to get a free anonymous estimate of what your health insurance could look like. So the marketplace is a term designated by the federal government, and it describes what we offer and the other Affordable Care Act exchanges offer. So individual health plans, individual dental plans, small business health and dental. In Connecticut, that's for 50 employees or less. And any time of year, we can see if you qualify for Medicaid or Children's Health Insurance Program, the CHIP program. So that's 12 months a year for that. I think what makes the Affordable Care Act so great are the essential health benefits. And the Affordable Care Act mandated that these are the 10 essential health benefits of the plans. So prescription drugs, preventive services, outpatient care, lab services, pediatric services, trips to the ER, treatment in the hospital, care before and after a baby is born, mental health and substance use disorder services, services and devices to help you recover if you are injured, have a disability, or a chronic condition. And I think what we have seen in the last year is due to the pandemic, a lot of different people are losing their jobs and they may not be familiar with how to get health insurance because they've always gotten it through their job. So the health insurance exchange in your state is another option to get health insurance. So if you go to healthcare.gov, you can find information for each individual state. The marketplace helps uninsured people find health insurance. And when you fill out an application, they'll tell you if you qualify for a private insurance plan or Medicaid or Husky. And I think that's important because people are worried like they're not going to get the least expensive, most comprehensive plan. But when you do an application through the marketplace, they'll evaluate you for both. And keep that in mind, that website, healthcare.gov. Many states have run their plans through healthcare.gov, but there are also states that have individual health insurance exchanges like we do in Connecticut with Access Health Connecticut. But all of us can be found at healthcare.gov. For the private insurance plans, typically you can only enroll during open enrollment unless you qualify for a special enrollment period. And we'll have more about that at the next slide. So if you're eligible for job-based insurance, you can consider switching to a marketplace plan. But if you can't be enrolled in a job-based plan and a marketplace plan with savings at the same time, if you're not enrolled in a job-based plan but are offered one, you may not qualify for savings based on your income unless the job-based plan is unaffordable. And there's actually a calculation done by the IRS to tell you whether your plan is affordable. And you would go to irs.gov for more information, and you'd also need the help of your HR department at your job. The next bullet point is if you experience certain life events like moving to a new state, you get married, have a child, you lose your coverage through divorce, through job loss, etc., you may qualify for a special enrollment period to enroll in or change your marketplace plan outside of open enrollment. So traditional open enrollment is November 1st to December 15th. Typically, the rest of the year, you would need a special enrollment reason, like I just mentioned. Because of the pandemic, we actually are having a special enrollment period right now that's very broad, and it's a benefit of the American Rescue Plan, and I'll talk about that a little later. But overall, I want you to know it's always a good time to reach out, and then you can get more information from your health insurance exchange. So again, on this slide, you'll see healthcare.gov, or you can call the Marketplace call center at 800-318-2596. TTY users can call 855-889-4325. I am super excited about the American Rescue Plan Act of 2021. President Biden signed this into law on March 11th, and the goal is to make health insurance coverage more affordable and accessible, not just for Connecticut residents, but across the country, by virtually eliminating or vastly reducing monthly payments or premiums for many people with low and moderate incomes. So my slide was for who enroll through Access Health Connecticut, but it would be with your local health insurance exchange. It also, which is new, it provides new financial help for people with somewhat higher incomes who may face high premiums. And that's new. There used to be a cutoff based on your income, but you're no longer going to see that. So it's important, if you have any questions, again, to reach out to your health insurance exchange. So if you need coverage in 2021, we have this special enrollment period due to the American Rescue Plan, and it's through August 15th. That's a key date. And this is due to the coronavirus. The special enrollment period is available to residents in the 36 states that use healthcare.gov, or if your state runs its own marketplace like Access Health. Most states are offering similar options to enroll. After you fill out and submit your application at healthcare.gov or at your local health insurance exchange, you have 30 days to enroll in a plan. Coverage starts on the first day of the month after you enroll. For example, if you enroll anytime in March, it would start effective April 1st. I do think you'd have to check with your different state to see your exact effective date because it's a little different depending on your state. So the 4 things to know for the special enrollment period is you may qualify to save money, and most people do. In fact, 9 out of 10 people who enroll are eligible for savings. Millions more people can find plans for lower premiums due to COVID relief law. In fact, 4 out of 5 can find a plan for $10 or less after savings. Again, go to healthcare.gov /more-savings. But just get to healthcare.gov. They're advertising it all over their website. So interesting, no special enrollment period, no life event, no problem. The special enrollment period doesn't require you to have a qualifying life event like the birth of a child, a move, marriage, or divorce to enroll in a marketplace plan. COVID-19 has brought new challenges for a lot of people, so this special enrollment period offers equal access to coverage for those in states that use healthcare.gov. And that's pretty spectacular. It's very broad, and again, that date to remember, August 15th. Next slide. I think we talked about this. If you're eligible for job-based insurance, you have to find out if it's unaffordable. And again, you can do that if you go to healthcare.gov or if you go to irs.gov for those formulas. The second one, if you're eligible for certain life events like moving, I want you to know that after August 15th, that special enrollment periods will still be available. So you have 60 days before or after you have a change, for example, moving, having a baby, losing your coverage for a number of reasons. Maybe you get divorced and the coverage follows your spouse, etc. So if this isn't applicable to you this year, keep it in mind for your family and friends as you go forward, that they have that 60-day window. And of course, you can be eligible and apply for Medicaid and CHIP 12 months a year. To learn more, again, it's at healthcare.gov. So my summary is you can enroll this year in 2021 health insurance. You can enroll in Medicaid or CHIP any time of year. Don't forget to pay your monthly premium. Your first premium is what's going to get your coverage rolling. And try to stay healthy and get the care that you need. I think the government's really trying to supplement these plans and make them more affordable and be more helpful to people. So again, any questions, and this covers all the states, it's at healthcare.gov for more information and to connect to your state's local information. Thank you so much. I appreciate your time.
And thank you, Ellen, for joining us today and for providing all of that really helpful information about how not just Access Health Connecticut works, but how people in states all across the country can shop for health insurance through the healthcare.gov and through their state exchange, and to hopefully find financial assistance to make it affordable for them and their families while still meeting their healthcare needs. But thank you so much. I'm now going to turn over to our next speaker, who is Michael Leiner. Michael is a disability lawyer and expert from Cleveland, Ohio. He founded Leiner Legal Disability Lawyers in 2013 and has successfully represented thousands of claimants seeking Social Security disability benefits at all stages of litigation. Michael also founded Elevate Disability in 2020, so just last year, a project aimed at improving the delivery of information about the disability programs to impacted consumers and to the general public. In addition to all of these professional accomplishments, Michael serves on numerous community and nonprofit boards. Michael, we're so excited to have you here today. Please take it away.
Thank you so much for inviting me. And it's such a big topic, but I'm going to do the best that I can to condense it into a shorter bit for everybody. There's two main disability programs that are out there that I talk about. There's a program called SSDI, Social Security Disability Insurance, and then another program that's called SSI, Supplemental Security Income. And the big thing that I want to make people aware of is really just kind of the key differences between the two of them, and spend most of my time talking to you, just giving you some tips on how, if you are applying for disability benefits, you can improve your chance of success. The first program is that I mentioned. It's called SSDI, Social Security Disability Insurance. And the key thing there is to remember that SSDI is a program that's intended for people who have worked and paid into Social Security. Generally speaking, somebody has to have paid into Social Security for 5 of the 10 years immediately prior to becoming disabled in order to receive SSDI benefits. And then there's some things that come along with SSD if you're approved for it. If you're awarded SSD benefits, it comes with Medicare. If you have dependent children, you can actually receive additional benefits for your children. It's the main principal Social Security benefit that's offered for people who are unable to work full time, which is essentially the way of describing for people, who qualifies. You have to demonstrate that you can't do any full-time work. Now, what the other disability program that's offered is called SSI, Supplemental Security Income. And as far as what you have to prove in a disability case medically, an SSI case, it's the same for both benefits. Again, you just have to demonstrate that there's no full-time work that you're able to perform. But where it's different is that while SSDI has a work credit requirement, you have to have paid into Social Security. With SSI, you never have to have worked a day in your life. On the other hand, with SSI, it's a needs-based benefit. It's essentially a welfare benefit for people who are disabled. So instead of counting your work credits, SSI is going to be based on having very little income or resources available to you, plus being unable to work full time. And the general rule of thumb is that people who, the rules that we need to play by, to apply for SSI, you need to have under $2,000 in countable resources, which people are shocked when they find out that number was actually implemented during the Nixon administration. So you can imagine how much $2,000 has changed from the early 70s to what it is today. SSI comes with Medicaid benefits as opposed to Medicare, and there's no extra dependent benefits for any children you may have who are disabled. And there's some other nuances that I would be happy to address for people who had individual questions, but I want to kind of get to the goods here. So I want to give people some information on what makes a disability case successful. And this slide is based on me having focused my entire career on these cases, the last 10 plus years, and handling thousands and thousands of these cases successfully. The most important thing in a Social Security case, regardless of what type of which benefit you're applying for, is to have a positive patient-provider relationship. And let me explain that a little bit. People do not get approved for disability benefits because of what they tell me as their lawyer is wrong, or because of how you fill out any paperwork that Social Security sends you to complete. People get approved for disability benefits because of what their medical records say. And that's so important. And even taking it a step further, people get approved because of the functional limitations that are laid out in their medical records. So the reason that I really stressed to my clients the importance of having a positive patient-provider relationship is because I think that all of the things that go into a successful case flow from there. If you have a doctor who you're not comfortable telling your symptoms to, or who you feel rushes you through your appointments, the odds of them documenting everything that's needed to be successful with a case are small, or they're certainly smaller than they would be with a doctor who you felt gave you the time, and a doctor who you were comfortable, sharing the uncomfortable parts of your life. The attendees of this conference we're covering such a large range of disorders and diseases that it's difficult to, say specific symptoms, but if you're uncomfortable telling those difficult details to your medical provider, the odds of them, writing things down are small. Additionally, it's so important to communicate with the provider because, and what you really want to do is see if you can get a copy of your medical records, which has become so much easier with the advent of electronic records, but to make sure that your doctor is really documenting what your symptoms are. And I may come back to this later, but what's so important is not that you are... what I try and communicate to people who are applying for disability is that you need to. I'm going to go forward with this. The next thing that's truly important in a case is conscientious form filling, and I'm going to return to that prior point, but I got out of order here. What people should know is that the forms that Social Security will send you in a Social Security case. They don't send those to people to fill out because Social Security is going to approve you for benefits based on what you tell them is wrong. Usually they're going to approve people, again, based on what the records say. But what they do is they review the forms that people fill out. There's several forms that get filled out in a case. There's a form that's called a work history report, which asks you to detail the last 15 years of your work. There's a form that's called a function report, which asks you to describe your daily symptoms. What they will do with those forms is try and pick apart why you aren't disabled or find the fallacies in your case. So really making sure that you are describing in anything from Social Security, not just Social Security might ask on a form how are you limited in your ability to cook, or can you cook, or can you clean? You don't just want to give an answer like, yes, I can prepare meals, yes, I can clean. What you instead want to do is make sure that you're describing how you're limited in your ability to do daily activities, what's changed, because getting away from that and just quickly filling out forms without much thought can be a trigger for Social Security to pick holes in the case and give reasons to why you can return to work. If you say that you're able to prepare meals, their response is, McDonald's is hiring. If you say that you're able to do cleaning chores around the house, there's a hotel down the street that you could be a housekeeping cleaner at. They will extrapolate beyond what's reasonable, but the best way to control that is to make sure that when you're filling out forms, you're not only answering the questions, but you're describing for them how you're limited in your ability to perform whatever they're asking you about. These other things I can fly through here. Adhering to deadlines is, of course, important. After a disability denial at any stage, you have 60 days to file that appeal. You always want to keep moving your disability case forward. If you get denied, it's not a reason to start over. With very, very, very few exceptions, what you want to do is appeal your case. So adhere to the deadlines that are laid out in those letters, which kind of plays into the last bullet point that we have here, patience and understanding. It is so important to understand these are slow cases. And a typical disability case from beginning to end, depending on where you are in the country, because it's localized, can take from 1 year to 4 years. And so understanding that it's a process, that you need to file those appeals and keep with it, is so crucial to ultimately being awarded benefits in the end. And then the other thing that I want to get across is understanding what the definition of disability is, which I laid out for you at the beginning of the presentation. It's an inability to work full time. And other organizations or other bodies that may award disability, like a long-term disability carrier, or if you're receiving disability through your state, maybe to get medical, they may have their own definition of disability, and you need to be aware of what Social Security's definition of disability is, so that you're generating the right type of medical record. So it's a big topic that I did my best to condense, and if anybody has questions about benefits, I would be more than glad to answer them later on.
That was fantastic, Michael. Thank you so much. We are going to go into our last presentation today from NORD's very own Jill Pollander. So Jill serves as NORD's Director of Patient Services. She and her team assist nearly 10,000 patients annually with access to necessary care and treatment for their rare diagnoses. Prior to joining NORD, Jill led underwriting and physician services for a professional liability insurer. As a registered nurse, Jill has over 30 years of diverse professional healthcare experience from the emergency department to long-term care with a specialty in pain management and palliative care. From experience, I can say that Jill is a very fierce advocate for patients and their access to appropriate care and treatment. Jill, it's always lovely to see you. The floor is now yours.
Thank you, Corinne, and thank you to Ellen and Michael for your thoughtful information and for providing a great lead to discuss patient assistance programs. Living rare is challenging, and that's on top of all of the usual challenges that life presents. In my role as Director of Patient Services for the National Organization for Rare Disorders, I and my team strive to lessen some of those challenges, especially when it comes to accessing care and treatment. That's the focus of NORD Patient Services and what patient assistance programs are designed to do. What is patient assistance? Patient assistance is about helping patients to access care, and patient assistance programs, or PAPs, are designed to provide eligible individuals with that access to care and treatment. Typically, this is in the form of financial assistance. And patient access refers to the availability of health care and the ability to access those healthcare resources for care and treatment. For patients living with rare diseases, the challenges faced often started with getting a diagnosis. This challenge is seen in time, access to specialists, and the costs associated with medical consults and diagnostic testing. Once there is a diagnosis, there's the question of treatment. For the approximately 5% of rare diagnoses that do have treatments, the challenge then turns to accessing and affording that treatment. We all recognize that healthcare is not inexpensive, and the expenses associated with managing a rare diagnosis can be a tremendous burden. That access from a cost standpoint, whether for diagnosis or care, is where patient assistance programs come in. Before we talk about the types of assistance that may be available, it bears mentioning that even where assistance programs exist, there are eligibility requirements, and not everyone will meet those requirements. All providers of patient assistance programs must adhere to regulatory requirements. These requirements, in part, are dictated by who is administering the program. There is a difference between what a pharmaceutical company, biotech, or manufacturer can provide in terms of assistance and eligibility criteria compared to a foundation or charity such as NORD. Program eligibility requirements may include a specific diagnosis, citizenship or residency requirements, financial eligibility, health insurance, and type of insurance. One key for compliant patient assistance programs is that eligibility requirements must be consistently applied for every applicant. So what types of patient assistance are available? Patient assistance programs can take many forms. They may provide financial assistance for things like health insurance premiums, deductibles, and/or out-of-pocket costs like copays for doctor's visits and medical consults and medications. They may cover out-of-pocket costs for diagnostic and laboratory tests, radiological studies, and supportive therapies like physical therapy, occupational therapy, speech, or audiology services. Some assist with the cost of infusion, durable medical equipment, or adaptive equipment. And still others provide travel and lodging assistance. Patient assistance may take the form of discount coupons or vouchers. They may take the form of reimbursements or prepaying for care or treatment. Patient assistance programs may cover some or all aspects of rare care. Not all assistance programs cover all of these costs and services. So it's really important to ask questions of patient assistance program providers to determine the breadth of assistance that may be available. NORD has a large number of patient assistance programs and types of programs, but not all program types are available for all diagnoses. NORD, as the umbrella organization for the rare disease community, takes a multi-pronged approach to patient assistance programs. While we wish we could provide financial assistance for all rare diseases to access care and treatment, we are dependent on donors and funding in order to provide patient assistance. It's important to us that we assist patients with the nuanced needs of living rare. That's how we design our programs. So we've looked beyond solely the physical needs of health to provide access to services that will help the rare community to live their best rare lives. I mentioned earlier that it's important to ask what assistance and services are available. It's also important to understand that PAP availability can change based on funding and grants. At NORD, our website provides a listing of all of our patient assistance programs, and this is kept current, so checking the site is a great resource. We're grateful to be able to provide the rare disease community with assistance not only through our more traditional PAPs, but through innovative and responsive programs like our Rare Caregiver Respite Program. The Rare Caregiver Respite Program provides financial assistance to a family member or significant other caregiver of a rare patient so that this caregiver can hire a respite caregiver and take a well-deserved break. We launched our Rare Disease Educational Support Program. This program provides reimbursement for registration costs for rare disease educational offerings, as well as programs that support patients' health and well-being, such as workshops, classes, and conferences. In addition to assisting with registration fees, the Rare Disease Educational Support Program provides limited financial assistance to patients and caregivers for travel and lodging costs to attend these educational programs. One of our newest programs is a partnership between NORD and MedicAlert Foundation. The MedicAlert Assistance Program provides eligible rare disease patients with a MedicAlert product and 3 years of MedicAlert membership and monitoring. This service can provide vital, life-saving information in the event of emergency situation. At NORD, we're honored to be a partner in your rare disease journey. We are here for you, and we look forward to assisting you. These are members of the Patient Services team, and we are here to help. Thank you.
Thank you, Jill, and all of our speakers for that really wonderful and informative presentations. We have a bit of time left for Q&A, and I'm going to go a bit out of order, actually, and start with Jill to follow up on that presentation that you just did right away. So something that you didn't touch on your presentation, but is something that we've heard a bit about, is that for some patients, it is hard to ask for help or to feel like you are seeking or receiving charity. And that can be a barrier for some folks. So what would you, in your capacity, say to those patients who are both struggling to afford their treatment, but also struggling with the decision of whether or not they should be seeking out patient assistance?
Thanks, Corinne. That's a great question. Asking for help really can be challenging for some. But think about patient assistance as providing access. Just as you might need a ride to the doctor, that ride gets you where you need to be. Patient assistance programs may be the resource that gets you what you need. It may provide a path to care and treatment to facilitate your health and well-being. Sometimes asking for assistance is exactly what one needs to do in order to take care of themselves. If you're having difficulty affording your care or treatment, patient assistance programs may mean the difference between getting needed care or not.
No, that's really helpful, Jill. Thank you. And maybe now let's turn to our first speaker of the night, Ellen. During your whole presentation, you touched on this a fair bit, but struck me what a strange year and a half this has been for people, and especially for patients who are shopping for health insurance. Just thinking about coronavirus and the special enrollment periods that came out of that, where first you couldn't sign up for health insurance, then you could, and now there's special additional financial subsidies. And we do this for our jobs at Nord, but I could imagine how someone looking at the news could be incredibly confused about what the American Rescue Plan and what the chief takeaways are. So all of that lead up, this is my question. With everything that has been going on with the American Rescue Plan and the special enrollment periods, what are the top things that you think patients need to know about what the American Rescue Plan is and how it impacts them and their search for insurance?
Thank you, Corinne. I definitely think the effective dates of this special enrollment period for the American Rescue Plan, so May 1st to August 15th, also that they should go to healthcare.gov, since we're talking about everybody across the country on your call, and that will lead them either they'll continue on healthcare.gov or they'll go to the local state health insurance exchange, like in Connecticut, it's accesshealthct.gov. accesshealthct.com. And I would say that you start the application and ask the questions and look for the information. They've really gone to a lot of trouble to have them information online and accessible. And I know in Connecticut, we have some navigators you could see in person. You can also speak to brokers who specialize in health insurance, and they also are aware of the health insurance exchange, and they can give you some advice too when you're choosing between plans and you're not sure what to do. But I think the first step is definitely get to healthcare.gov and get rolling and get that application started. I don't think it's going to be as difficult as people imagine. It just takes a little bit of effort.
I think that's a very good point. You've talked about all the different resources that are available at healthcare.gov, and you just talked about navigators and brokers. These are other tools and resources that are out there for patients to help to demystify the process and to provide assistance. The most important thing is just to get started, I think is something that you've brought up as well. All right, Michael, my question for you is sort of twofold. Applying for Social Security disability benefits, it can be complex and confusing. So first, how should patients start that conversation with their doctor? And two, when should patients be applying for disability benefits?
Sure, thank you. So to answer your first question about how to start that conversation, I'm not sure that you ever need to telegraph to your doctor that you're applying for disability. And this is actually the point that I was internally debating whether or not to make it earlier in the presentation or wait until now to offer it, because I knew it was going to come up. What I tell my clients is don't treat to get disability, treat to get better, treat to improve your health. Because the same way that you are ultimately awarded disability benefits is the same way that you're going to see better results in your health. But if you're focused on improvement, if you're focused on how can I do more tomorrow than I did today, how can I do more today than I did yesterday, the outcome is going to be much better. And the way that translates in a doctor's office is instead of going to a doctor and saying, I need this financial benefit, can you help me get it? It's a more positive approach to say, doctor, I'm having a lot of health issues. I'm having these 7 symptoms. They're greatly interfering with my activities, including work. What we need a plan. What can we do to get better? Because when you do that, one, it tells the doctor, maybe we need to order this test, or maybe we need to order that test, something that they aren't naturally arriving at anyways. If you're not doing that, a lot of times you're playing pin the tail on the donkey in the doctor's office. You're just hoping that they ask the right question. Instead, if you go in there with a plan for here's what's going on, here's how it's limiting me, one, you actually have the best chance of seeing the benefit that you want, which is, your health back. Otherwise, what you've done is you've done a nice job documenting all of the limitations that you're having that keep you from being able to work. And then the second part of your question, do you mind repeating it?
Yes, I can. It is when should patients be applying for disability benefits?
Great. And Social Security, even though it requires a diagnosis, it's not a diagnosis-driven agency. What matters is your functional limitations. So, the fact that somebody has, let's say, a form of cancer, that won't, in some circumstances it will, depending if you have a terminal illness, you could automatically get awarded because of a diagnosis, but that's very rare. Usually what a disability case is going to be based on is how the symptoms of that diagnosis are affecting work functioning, how it's affecting your ability to sit, stand, lift and carry objects, think, use your hands. So as soon as you realize that you are unable to functionally perform the demands of your work because of your disability, that's when it's a good time to apply, as opposed to people who will say, oh, I got this diagnosis, I better turn in an application. Well, if you don't have the records yet, if you haven't, created that paper trail and established the functional limitations, it's probably a little bit too soon to decide at that point, just with the diagnosis alone, that you want to apply.
That's really helpful, Michael. Thank you. We are cruising close to the time for our session. I think we can do one more question, and I'm going to direct this at NORD's very own Jill. So Jill, I know that NORD is not the only nonprofit that is out there providing patient assistance. Could you talk very briefly about, do all charities and foundations provide the same assistance? Could a patient receive assistance from more than one patient assistance program from a different organization other than NORD?
Thanks, Corinne. Different patient assistance programs provide different services and support. You can receive assistance from more than one program, but not for the same need. So if you're receiving assistance for medication costs, and you're getting medication cost assistance from a manufacturer, you can't apply to NORD for assistance with your medication costs. But if NORD has a program that provides premium assistance for your diagnosis, you may be able to be eligible for premium assistance through NORD. So it's really important to ask about what is available when you're seeking patient assistance. The more that you understand, the better able you can target your asks for assistance and get what you need.